Hi, everybody. You are listening to the Medea podcast series. Medea Medical Education Academy is a global medical education provider dedicated to designing, delivering, and evaluating medical education programs worldwide. Today, we will be speaking with Urh Grošelj, Associate Professor of Paediatrics, Assistant Professor of Medical Ethics, and a member of both departments at the Faculty of Medicine of the University of Ljubljana, Slovenia. At the end of the podcast, learners should be able to outline best practice for newborn screening for PKU. This podcast is part of the continuing medical education program entitled PKU Blended Learning Journey 2025, targeting specialists in pediatric and adult inherited metabolic disorders, dietitians, nutritionists, clinical biochemists and geneticists, basic scientists, psychologists, gynaecologists and obstetricians, nurses and all healthcare professionals helping those with PKU. All materials will be suitable for all geographic regions.
Hello. Thank you very much for inviting me to this conversation, which I think is very important and vital. My name is Urh Grošelj. I'm Associate Professor of Paediatrics from University Children's Hospital Ljubljana, Slovenia, at the Faculty of Medicine, University of Ljubljana. Actually, my background is in metabolic pediatrics. I'm also coordinating the newborn screening program in Slovenia. I'm also clinically involved with the care for the PKU patient as well as many other rare diseases.
Can you describe the issues you are facing in Eastern Europe that impact your national screening program for PKU, please?
Actually, PKU is a compelling case study of how an early intervention through newborn screening can change lives, but also, unfortunately, how gaps in implementation continue to impact many children, especially if we were talking about Europe, especially in the eastern and southeastern part of Europe. Perhaps as a starting point, I can briefly talk about our survey now 10 years ago from 2015, where we surveyed, especially with focus on the southeastern Europe, on the issue of PKU, newborn screening and care for PKU. At that point, out of 11 countries, still no PKU screening was introduced in 4 out of these 11 countries from southeastern Europe. In addition, some countries with introduced screening had at that point significant coverage gaps, which means that large proportions of population were not screened. Actually, in addition, they face some other challenges. So not all countries had PKU registries. They were not having clear guidelines or national guidelines. Very rarely, the BH4 therapy, for example, was available, and genetic diagnostics was not routinely available in majority of countries. Of course, this region is highly diverse, so there were few countries that actually were doing already at that point, we could say, extremely well or fine, but of course many other countries did not so good. If we now look at the progress during the last 10 years, we can see that there is some significant progress to be observed. So currently, at least some kind of pilot, or I would say regional screening or first attempts, are now present throughout the region according to the last effort, but still few countries are actually, we can say, quite far from a functionable newborn screening program which would be regularly implemented and would have full national coverage, which we should see as a final goal. But of course, there were some significant improvements reported in some countries, for example, in Romania or Bulgaria. But still, they report a shortage of trained personnel in some countries. Still, some countries have problems with coverage, but we can still see important progress. So there are some persistent challenges. One group of challenges are the systemic gaps. So many countries still lack centralized coordination of their newborn screening programs and total coverage. Funding might be inconsistent in some cases. The training and availability of trained healthcare personnel may also be a challenge. There's also a lack of harmonized standards, so still there are diversities in how newborn screening is being executed, and some discrepancies are really not based on the best possible care that could be provided. There is some equity in access issues. Some rural populations, some marginalized communities or refugees groups are still not actually having good access to newborn screening programs in this region.
In your opinion, what is needed to remedy these issues?
This is also an important question. So, first of all, I think all countries in the region, and we can say throughout the Europe, must adopt national mandatory newborn screening program for PKU, which would be supported by public health infrastructure, and adequate training of healthcare personnel should be provided. This include timely sampling, sensitive testing methods, like now we have Tandemas is a standard diagnostic method, and adequate follow-up. What would be important would be to actually provide a policy. So the countries must legalize the newborn screening program to be mandatory nationwide. So not only to stop at some partial or pilot projects. Secondly, we would need a strong regional collaboration. So, as I mentioned before, there are some countries with well established and well executed newborn screening programs, which could maybe mentor and support those who lag behind with building capacity. There could be some kind of twinning initiatives, training models, pooled quality control mechanisms, which could provide some improvements and help those countries which are a bit more struggling. So we would need harmonized protocols across the region, which I think there are currently still pronounced discrepancies in the way newborn screening is executed, and many of these discrepancies are not really scientifically based. We must also invest in data and central data infrastructure. So national PKU registries are essential, because it's not enough that we only do screening, but we must also follow then the people with PKU, because we must always assure that we are doing more good than harm, assure not to have too many false positives, and also to provide adequate follow-up and adequate treatments to all of those who are detected with newborn screening programs.
What is the impact on patients and parents of the imperfect screening process, and is the impact equal across the population?
This is another very good question. So PKU is actually inherited metabolic disorder, one of the most common, if not the most common, inherited metabolic disorder. And the problem is that the impact of untreated PKU is devastating. It leads to severe intellectual disability, behavioral disturbances, epilepsy, and more. But it is also, at the same hand, if treated adequately, one of the most preventable causes of mental disability. So the precondition is that the patients, the people with PKU, are diagnosed early, actually through the newborn screening program. These are all the reasons why PKU became the first condition for which systematic newborn screening was introduced. Very recently, we celebrated the 60th anniversary of the implementation of newborn screening for PKU, which is very important public health milestone that began with Robert Gutter's visionary work in the early 1960s. Since then, PKU screening has transformed from a pioneering pilot into a global standard of care, preventing hundreds, thousands cases of intellectual disability. Yet, as we reflect on 6 decades of progress, it's still that not all regions, one of such regions, especially if we're talking about Europe, is the Southeastern Europe, are not sharing equally in this success. So our conversation today is a call to action to ensure that next chapter of PKU screening is defined by equity in access and collaboration. So if untreated PKU, the human cost is significant. And of course, in people with those where the PKU was missed or was not diagnosed early enough, there is a irreversible damage done, and it leads to huge burden for families and for the society, which is actually completely unacceptable as of year 2025. And in such cases, the newborn screening would be really life-changing for these families. But of course, even if we have a screening program, it should be performed according to good practice. Sometimes there could be still a lack of clear communication. There could be delays in confirmation. Any false positives can also significantly affect the family. So not just to introduce the newborn screening program, but we must also strive for a proper execution of any newborn screening programs. And still, as I mentioned before, there is not an equal access to all the segments of population provided. There are some families in more remote areas or border regions or some marginalized communities, as a Roma population, for example, or refugees now, which also have not equal access to these programs.
What take-home messages do we have at the end of this podcast?
Yes, there are several take-home messages. We can say that PKU screening is one of the medicine's great public health success stories, but still its benefits remain unevenly distributed. So one such a region is Southeastern Europe, where we can still perceive a huge differences among different countries. Some of the countries are really leading, having top tier programs comparable to any most advanced program elsewhere, but few of the countries are still significantly lagging behind. Though we've seen some real progress in the last 10 years, which I think it gives some reasons for satisfaction, though we are still not there yet. So my hope is that within the next decade, every child in the region will have access to effective, timely, and well-executed PKU screening program. I think with political will, regional collaboration, and sustained professional advocacy, this goal is achievable. I must give one example of Ukraine, which expanded newborn screening programs in 2023, despite all dire circumstances. So it's actually clearly proving that a change is possible even outside ideal circumstances if there is a significant will and support also from maybe those who are in a better position.
Thank you for listening to this Medea podcast. For more information about our continuing medical education programs, please visit our website at medeaacademy.com.